Assalamu alaikum. My name is Nafiese Salaam. I'm the founder of ISAN, the Islamic Health Support Network. I'm here at Philadelphia Fight with Waheeda Shabazz L, one of the most influential women, persons actually in the city of Philadelphia that's enjoined in this jihad against HIV. Assalamu alaikum. Can you tell us a little bit about the work you do in the city?
Well, absolutely. I'm a retired postal worker. I'm currently employed now at Philadelphia Fight. I do HIV testing and counseling, and I also do prison reentry work here at Philly Fight. Nationally, I'm one of the founding members of the United States Politics Women Network. I recently got to meet President Barack Obama, and I've been recently invited to sit on the President's Advisory Council for HIV. Internationally, I'm a member of the ICW, that's the International Community of Women Living with HIV.
Okay,
so I get around a little bit.
Good. Wow.
Many believers in this country are Islamic believers.
True.
You know,
true,
and yeah, so and we take the Shahada, La ilaha illallah, Muhammad Rasulullah. We take the Shahada. But a lot of times what people don't understand, what I hope that our leadership begins to understand is that HIV may be a behavior that happened pre-Shahada. Before a person made the commitment to go down the right path.
Yeah.
You know what I'm saying?
True, that is true.
Yeah. So where does that believer get their support? You know, I just feel it's a disservice. It's a disservice to believers that they will have to go to non-believers to get support, or outside, I should say now, yeah, maybe we can cut that. I should say outside organizations to get the support that they need. So, most leadership is what leadership says. Leadership comes from the top down. Leadership comes from the top down. And we need to hear these messages coming out of our Juma. We need to hear these messages coming out from our Imams and our leadership that people should get tested. Believers, Muslims should be getting tested, particularly if you are in a polygamous marriage.
Right.
You know, there are some risks. There are some
definitely.
risks that we don't always like to talk about. Another thing that's important to me is that we have to establish some sort of criteria, because HIV is here. When we have couples who want to get married, and we have the wali or the wakil, who's the intercessor, right, for the marriage, and the marriage doesn't happen, this wali or wakil has that information that this woman or man may be HIV positive.
Yeah.
What do we do with that information now that person has it? What kind of structure is going to be set up, or rules are going to be set up? You know, for that sort of conduct. Right. So we have a pandemic that's going on, and that we have to raise the bar, and we have to really have some a lot of discussion around this issue. It's a reality for many people, and because we only have to extrapolate, we don't know exactly how many Muslims may be living with HIV or may be infected with HIV. But we know the communities that are affected overall by HIV. Communities of poverty, community where there's a lot of drugs, and community where there's a lot of sex work going on, communities where there's single parent households, community where there's a lack of education and lack of health care, and lack of social determinants, right?
So then it would be safe to say that education within these communities, within impoverished communities, communities that are drug infested, communities that lack health care, if they had education, this would also lower the stereotype associated with HIV, because they would know then, correct?
Absolutely. All those things you just said, Brother Nafiese, is HIV prevention.
Right.
Some people think, and I know that in the Islamic community, that we frown and we look down on sex outside of marriage. But I need to say something here about condom protection. Some people believe that all you have to do to protect yourself from HIV is put on a condom. HIV is a political, social, economic disease.
Yes. Yeah.
We have to get people educated. That's HIV prevention. We have to put people in houses, stable housing. That's HIV prevention. We have to get people, people who are coming out of incarceration, get them into reentry programs. That's HIV prevention. Substance abuse programs. That's HIV prevention. Relationship counseling. That's HIV prevention.
Yes, it is.
HIV prevention is so much more. HIV prevention is education. People think that it's only about putting on a barrier if you're going to have if you're going to have sex, you know. But the thought process before you even get to the sex has to be changed and has to be upgraded.
Yeah.
Because we have to understand that we are living in an environment that is not safe for communities, you know. And so I would extrapolate that HIV has absolutely fallen over into the Islamic community, and it resides in our community. Yes, it does. Yes. And the reason I say that is because we have an AIDS activity coordinating office that collects data in the geographical areas of the city where what parts of the city are hardest hit with HIV.
That's ACO, right?
ACO.
Right.
ACO coordinating office. It's a part of the health department.
Right.
And in these hot spots, these hotspot areas, this is where the believers live. It's not as though the believers live on a planet somewhere else, and everybody else lives in the city. So we live in these hot spots. We live and we grow there, and we can extrapolate from the information and the statistics from ACO that yes, there are believers in these zip codes as well living with HIV.
Yeah, that's something. Why is it important to have HIV testing, education, and testing within the Islamic community?
There is a world health crisis going on, you know, and Muslims have an obligation to. We need to protect ourselves as well. We have the Quran, we have the Sunnah, you know, but we also have science. And the science says, you know, that this is an epidemic that's out of control. The science says that it's an epidemic that people, and here's the thing, brother, people come into Islam already HIV positive.
True.
Pre-Shahada behavior, you know, some of the behaviors that we do before we understand the right path, right, may cause us to become infected with HIV before we even take Shahada.
Okay, yeah.
So, and so that comes along with it, and we fail to address the fact that people have behaviors that may have gotten them HIV, you know,
prior to them accepting the
deen of Islam, you know, and we have to be real, and as Muslims we have to be down to the modern time. And the modern time today says that HIV testing, HIV education is healthy, makes healthy communities. We are the Islamic community, but we are part of the world community. We are part of a larger community.
True that.
You know? And until all of us are well, right? And until as long as one of us is sick, I should say, then none of us are well.
Wow. That's a powerful statement. Yeah. So what can masjids and Muslims as a whole in the city of Philadelphia do to raise education and lower the stereotypes associated with it?
I believe that we need to become a part of the dialogue that is going on. I believe that we cannot stand on the sidelines and say that we are not a part of the solution, because if we're not being a part of the solution, we're probably being a part of the problem, you know, and we need to educate our youth. We need to educate our seniors, you know.
Seniors too, right?
There's no cure. There's no available cure for HIV at this time. But what we do have to combat HIV is education. It is our responsibility to our community to ensure that we're getting the accurate, correct, honest information about HIV, and that we're able to have these conversations about a disease that is running rampant throughout the entire world.
Yeah.
We as an Islamic community have to have this dialogue with the health department. We have to have this dialogue with HIV organizations. We have to bring literature into our masjids. We have to bring opportunities to access care and to access HIV-related services into our masjids, where people feel maybe more comfortable accessing those services. Yeah, we need to. Yeah, we have a moral responsibility to our community.
Yeah, we do. We definitely do.
Yeah, we do.
So as you see, HIV is a problem that not only has affected the Islamic community worldwide, it's affecting Philadelphia and is on the rise here in Philadelphia. So we at Hussein, the Islamic Health Support Network, challenge the Imams of this city to get involved, for the Muslims in their communities, in their jamaats, to get involved, to allow us to come into these masjids, to provide testing, to provide workshops, to provide dialogue, as the sister said, so we can open up a door of health literacy, and see if we can get this jamaat healthy. If you need any information concerning this, you can reach us at Hussein Islamic Health 1 at word.wordpress.com. You can email us at cryptpath.org, or you can call us at 267-636-2274. And always remember, worst comes to worst, my people come first.